നമ്മൾ ഇന്ന് ഡെങ്കി ഫീവർ അതുപോലെ തന്നെ ലെപ്റ്റോസ്പൈറോസിസ് ഇതിന്റെ മാനേജ്മെന്റ് പ്രത്യേകിച്ച് പ്രൈമറി കെയർ സെറ്റിംഗ്സിൽ അതുപോലെ തന്നെ ഇനീഷ്യലി മേജർ ഹോസ്പിറ്റൽസ് ഒക്കെ കാഷ്വാലിറ്റി കാണുമ്പോൾ ഇത്തരം കേസുകൾ എങ്ങനെ തിരിച്ചറിയണം, അതുപോലെ തന്നെ ഇനീഷ്യൽ മാനേജ്മെന്റ് എന്തൊക്കെ ആയിരിക്കണം എന്നുള്ളതിനെ പറ്റിയുള്ള ട്രെയിനിങ് ആണ് ഇന്ന് നടത്തുന്നത്. അത് പ്രത്യേകിച്ച് ഈ മൺസൂൺ സീസൺ സ്റ്റാർട്ടിങ്ങിന്റെ സമയത്ത് ആ ട്രെയിനിങ്ങിന് വളരെയധികം പ്രാധാന്യമുണ്ട്. അതുകൊണ്ട് തന്നെ എല്ലാ മെഡിക്കൽ ഓഫീസർമാരും അസിസ്റ്റന്റ് സർജൻ മറ്റുള്ള NHM ഡോക്ടേഴ്സ് എല്ലാവരും തന്നെ ട്രെയിനിങ് പൂർണ്ണമായും അറ്റൻറ്റീവ് ആയിട്ട് ഇരിക്കണമെന്ന് അഭ്യർത്ഥിക്കുകയാണ്. ഇന്നത്തെ ഈ ട്രെയിനിങ്ങിലേക്ക് എത്തിച്ചേർന്ന എല്ലാ അസിസ്റ്റന്റ് സർജൻ, CMOs, NHM അതുപോലെ തന്നെ അഡ്വോക് മറ്റ് കോൺട്രാക്ട് ഡോക്ടേഴ്സിനെ എല്ലാവരെയും ഈ ട്രെയിനിങ്ങിലേക്ക് സ്വാഗതം ചെയ്യുകയാണ്. ഈ ട്രെയിനിങ് പരിപാടി നയിക്കുന്നതിനായിട്ട് ഡോക്ടർ ലത പി, ജൂനിയർ കൺസൾട്ടന്റ് ഫിസിഷ്യൻ, ഡിസ്ട്രിക്ട് ഹോസ്പിറ്റൽ കണ്ണൂരിനെ ക്ഷണിക്കുന്നു.
Respected Deputy DMO Dr. Sachin, seniors and friends, good afternoon all. അപ്പം നേരെ തന്നെ ട്രെയിനിങ്ങിലേക്ക് കിടക്കാം. ഡോക്ടർ സച്ചിൻ പറഞ്ഞ പോലെ ഇത് ജസ്റ്റ് ഒരു റിഫ്രഷർ ട്രെയിനിങ് ആണ്. അറ്റ് ദ ഓൺസെറ്റ് ഓഫ് മൺസൂൺ we know number of dengue cases are increasing. It's not from this week. For the past 1.5 months we have been having an increase in number of cases. അതിൻ്റെ ഒരു ബേസിക് മാനേജ്മെന്റ് പ്ലസ് the most important thing in any illness is we have to recognize the patients who are sick and do the needful for them at the earliest. But it's very important that if you are having large number of cases, what is going to happen is we are going to miss critically ill patients, and that is going to increase the mortality. To prevent that, we should know what are the various danger signs in dengue, and that is what I'll be stressing more on. So I'll start sharing my screen. Okay. So first, I will start with dengue fever, and these are just the basics. I'll just go fast. It's a viral infection caused by virus under the genus Flaviviridae. It's a single-stranded RNA virus, and there are 4 serotypes: 1, 2, 3, and 4. In this, we have subtypes also. All the 4 serotypes are there in Kerala. And this is the vector, which we all know. It's Aedes aegypti. And these are the various sources where this vector breeds. And if you see the global distribution of dengue, we are in the endemic area. Now, if you see the clinical spectrum of the disease, if a person gets the dengue viral infection, there are 75% chances, around 3/4 of the patients may be asymptomatic. It's only 1/4 of the patient who becomes symptomatic. If you see, we have a large chunk of asymptomatic patient, but the situation becomes complicated. If you are having 1,000 cases of dengue fever per day, what happens is 250 becomes symptomatic, and of 250, around 2,500, 250 becomes symptomatic, and 25 to 50 can go into critical illness. So when you get large number of cases, it becomes a problem. The clinical manifestation can range from mild fever to severe, which include bleeding, shock, and organ dysfunction. And usually the disease, the symptomatic disease, evolves into 3 clinical phases. We have an acute febrile phase, the critical phase, and the convalescent phase or the recovery phase. Now, if you go with the average incubation period, it varies from 4 to 6 days. So we can know, if you take the history in areas where we are having dengue cases now, some family member had a fever or neighbors had fever 1 week back. Now I have got this fever. So in the epidemiological setting, most probably it could be dengue fever. So the average incubation is 4 to 6 days. However, it can range from 3 to 14 days. Now, what are the factors which affect the severity of the disease manifestations? See, all those who get infection, they don't get severe infection. So there are various factors. One is age. So elderly and in children, there are more chances of critical illness. The nutritional status, the immune status of the individual, presence of any comorbidities, type of strain of the dengue virus. So type 2 has got more severe infection, primary or secondary dengue infection. So secondary dengue infection is going to cause more severe symptoms and more critical illness. So at this point, I want to stress that, like how I said earlier, around 3/4 of the patients are asymptomatic. So suppose you get a patient who's coming with all the severe symptoms within the first 3 to 5 days of illness itself, there is a chance that it is a second infection. And probably the first infection was asymptomatic for that patient. We don't know. We may not get the exact history of a dengue fever 1 year back. So it doesn't mean that it's not a secondary infection. So any severe illness, one of the possibility could be that it is a secondary infection. Now, the high-risk groups, like how I said, infants and children less than 10 years of age, especially those with malnutrition. Elderly, age more than 65. So here at this point, so definitely when we are getting a lot of cases, the nutritional status is very important, especially if you have migrant population and all. So there, if the children get, there are more chances that they can go into critical illness. Elderly, age more than 65 years, obese individuals, pregnant ladies, hemolytic disease like glucose 6-phosphate dehydrogenase deficiency, thalassemia or other hemoglobinopathies. Actually, last month, we had a dengue death. In a 42-year-old individual, he was having sickle cell disease. He developed chest syndrome and patient expired. Congenital heart disease, chronic diseases like diabetes, hypertension, obstructive lung disease, cardiovascular disease, chronic renal failure, and chronic liver disease. And patients who are on long-term steroid or they're taking NSAID as treatment. So this single graph picture actually describes the entire clinical spectrum of this disease, including the lab changes and the various investigations which we have to do. So this is the febrile phase, which is in the first 2 to 3 days of the illness, where the temperature is very high. It can go up to 40 plus, up to 104-degree high-grade fever can be seen. At this time, the potential clinical issues include, one is dehydration. As a result of fever, people don't consume fluid. Then because of high temperature, there is increase in sensible, non-sensible loss of fluid. So that again, it's going to cause dehydration. And the lab values, more or less, it will be normal. The hematocrit and platelet value will be normal. The counts may be, WBC count will be low. And this is the stage of viremia. So importance of this stage is, for diagnostic is, the antigen-based test, that is the NS1 antigen test, which we usually do, will be positive if you do it in the first 3 to 5 days of fever. If you do beyond 5 days, most of the time NS1 will be negative. So it doesn't mean that it's not dengue fever. So it's very important that we time the investigation. And again, in this viremia phase, if you're doing an IgM antibody test, it will be most probably negative. Some cases, what we see is IgM is negative, NS1 is negative, IgG is positive. IgG usually indicates a previous infection. So we can at least say that this could be a secondary infection. Then the next phase is the critical phase, where what happens is the fever starts subsiding. Some people can get a second spike of fever during this phase. Here, what is going to happen is there is capillary leak, decrease in platelet count, and this can cause shock, bleeding, and various multi-organ involvement occurs in this phase. And during this phase, what happens? Gradually, the antigen disappears and the antibody formation starts. So towards the end of the critical phase, or by 6 to 7 days, are the antibody test which becomes positive. Then after 5 days, usually critical phase lasts for 24 to 48 hours, but some patients we see it goes beyond 3 days also. And then comes the recovery phase. So what is happening? The capillary leak, it stops, so fluid comes back. This is the stage where there can be fluid overload. The platelet counts start improving, the hematocrit value comes down, and the antibody test becomes positive. So this one slide, it sums up the entire dengue pathophysiology. So again, this is just whatever I have told. You can just go through the slide. The febrile phase lasts 2 to 7 days. Fever is usually high grade, biphasic, and fever is associated with headache, flushing, vomiting, myalgia, arthralgia, and macular rash. And the retroorbital pain, or the pain when they move their eye. Some of the patients, they really tell it's a very significant complaint. And rash is primarily a maculopapular or rubelliform rash, and usually appears after the 3rd to 4th day of fever, and it occurs over face, neck, chest, and abdomen, and fades away as the fever progresses. So this is the rash we see in dengue fever. Critical phase begins after 3rd or 4th day, lasts 24 to 48 hours. 5 to 10% of the patients in febrile phase may progress to this critical phase. And this is commonly observed in patients who have secondary infection. So what happens is in secondary infection, sometimes the critical phase may begin by second day itself. And after primary infection, patients with comorbidities and active co-infections also, this critical phase can be there. And this is characterized by vasculopathy and coagulopathy. So if you say the pathogenic mechanism, it's mainly vasculopathy and coagulopathy. There's nothing too much to think about it. What dengue fever, in dengue fever, what happens is the vascular endothelium is damaged, but it is not damaged permanently. It's just a reversible damage happening for few hours. So in this, when the vascular endothelial cell contracts, the gap increases, this produces capillary leak. Coagulopathy is because the coagulation factors starts reducing and this causes bleeding. Along with that, when the platelet count comes down, there is bleeding. So bleeding with capillary leak leads to shock, hypotension, and the severity of the disease. So plasma leakage leads to hemoconcentration, bleeding, shock, and organ dysfunction. Next, this is another important slide, which even if you don't remember any of the other things, this slide is extremely important. Warning signs of critical phase at the early stage. So if your patient is having persistent vomiting, abdominal pain and tenderness, lethargy or restless, sudden behavioral changes, bleeding manifestations like epistaxis, melena, hematemesis, excess menstrual bleeding, and hematuria, any syncope or giddiness, clinical fluid accumulation. Clinically, there can be ascites. Ascites, even if maybe you're not able to make out, pleural effusion, definitely we can make out, and we auscultate at the lower areas of the lungs, the breath sounds will be reduced. Some patients, what we see is they have developed facial puffiness, periorbital puffiness can be seen. Liver is enlarged and progressive increase in hematocrit with a rapid decrease in platelet count. So I think most of the FHCs have a lab facility. So if you're able to take a complete blood count, what you see is, if you take an account today, if the platelet count is like 1,05,000 with a hematocrit of maybe 38, HB of 11. Next day, if the platelet count is coming from 1 lakh to 40,000, there is a rapid decrease. Hematocrit becomes some 42, HB increases. Whenever the hematocrit rises, this hemoglobin also rises because there is hemoconcentration. Such kind of patients, it indicates that there is more chance that they can go into hypotension and shock. Now, this is the critical phase or the leakage phase. Here, what happens is, because there are fluid is leaking from the vascular compartment into the extravascular space, it leads to hypotension and shock. So any shock before the complete hypotensive shock, the body tries to compensate. So we have a compensated shock and this is decompensated shock. See, there's nothing much to worry. All these slides will be shared. One point what I want to stress is, in compensated shock, usually the patient's sensorium will be normal. The thing in which you have to concentrate maximum is the blood pressure. So if you measure it, that is one thing which we all can do in all institutions. So you measure the blood pressure, and if your systolic pressure is normal and the diastolic is little towards the higher side, it indicates that patient is in compensated shock. So if you don't manage the patient or if you don't refer the patient in time, the next what is going to happen is patient is going to decompensate.